I'm Maisha Robinson, a neurologist at the Mayo Clinic. May is Stroke Awareness Month. Each year in the United States, over 800,000 people have a stroke. The Mayo Clinic, in partnership with the American Heart Association and the American Stroke Association, are raising awareness about stroke. Minorities are certainly at higher risk of stroke than their Caucasian counterparts. And we don't understand exactly all the reasons behind this, but what we know is that the similar risk factors for stroke, which are apparent in the entire population, are more common, particularly in African Americans, such as poorly controlled blood pressure, high blood pressure, poorly controlled diabetes, high cholesterol. Obesity is often an issue as well, and a sedentary lifestyle. Smoking also may be more prevalent in that population. And so not only do we see higher risks of stroke in African American, but we see that African Americans also have higher morbidity and mortality, which means that they may be more devastated and more debilitated from the stroke, and there may also be a higher risk of death. And so knowing your numbers, being able to assess the situation, and then addressing the situation with regard to blood pressure, cholesterol, diabetes, weight, diet is very important, particularly in that population. African Americans historically are less likely to seek medical attention for a number of reasons. And so there are opportunities within the community, for instance, with churches or other social and civic groups that are focused on trying to improve the health care of the specific population. And some African Americans may feel more comfortable having their health care addressed there, but I would encourage them to also seek medical attention by their primary care doctor or a local physician to ensure that they know what their blood pressure is, know what the cholesterol is, know what their blood glucose is as well, in an effort to try to prevent stroke risk.